Welcome back, RevDivers. It has been a minute since we chatted with everybody. As you know, Kem and I were kind of bouncing around the country doing our spring circuit of speaker season stuff, right? Talking all over. And I think this time we actually went coast to coast, Kem. Did
We
we go
sure
coast to
did. We
coast this
actually went
spring?
international. So
Yeah, we did. Well, you did. You did. I didn't make that trip. We are super excited today, one, to be home in our own spaces, but also to be chatting about something kind of futuristic for us. So today we have Andrew Lockhart on the show. Andrew, welcome to the show.
Thanks for having me. Great to be here.
Absolutely. We're super excited. So, for those of you that don't know, Andrew's the CEO of Fathom, and they're all about AI tech for medical coding. And can you, this is so exciting for me. So, I don't want to get too nerdy. Kem and I are big nerds. I don't know if you can see that we both have Star Wars stuff in our backgrounds, but I want to talk first and foremost, just in case listeners don't know, can you give us a high level of like, what is AI?
Mhm. Yeah, so I mean, it's sort of an amorphous term that most people just use it to describe something that seems hard for a machine to do. Gets bucketed as AI, as it being intelligent. Like at one point spreadsheets were AI, and
Oh,
now
wow.
we have exciting. So whatever the bleeding edge of what machines can do tends to get bucketed as AI. The other way people sometimes think about it is the wave of technology, and so the flavor of AI that's really come to the forefront recently. If you guys have been playing around with things like ChatGPT or some of the image generation or deep fakes, this is all driven by something called deep learning. And what really stands out about deep learning and makes it different from historical waves of AI is that one, it seems just incredibly powerful, and the reason it does is the insight that drove all of it is rather than trying to create a whole bunch of rules to try and mimic sort of a human like decision pattern. What deep learning does is it just feeds a machine tons of inputs and outputs. So in our case at Fathom, tons of coded encounters, so documentation, final codes, and uses that. You feed that to cloud computing, and the machine ends up writing essentially millions of rules itself that allows it to do these very nuanced things. And that is what's driving this. The same sort of underpinning technology is what's driving cars and running all these exciting things.
So that makes me think of something. Like, I'm sure, Cam, you're probably in the same place, but like, I will go online in social media and I see, like, I made a bot watch, 15,000 episodes of Dawson's Creek and then write an episode. So I imagine it's kind of like that. We're feeding
Yeah.
information and just looking at the output. Does that mean I should be worried about like the Skynet, Terminator movies? Like, that's what comes to mind. When I think AI, I think, oh man, right, here comes this robot who can turn into a metal puddle and follow me everywhere if my name is Sarah Connor. Do I need to kind of worry about that, or is this, are we that
It's
still?
that is a subject of debate amongst people who are far smarter than me. And
And
so,
me.
yeah, I mean, it's interesting to me that like right now the world's most brilliant AI minds um, can't agree as to how much we should be cautious about this versus like full speed ahead. The potential there is obviously enormous. Like you think about just the challenges the U.S. healthcare system is going to face from a cost structure, and AI has the potential to drastically reduce cost of care and make it turn this system into something that's sustainable with an aging population. But yeah, there are a lot of people who feel like there's existential risk potentially here. Now the nice thing is it is all like software that exists in a cloud, so there is no puddle bots running around yet.
well, that's good to know. And glad to hear that there's no puddles that we need to be on the lookout for. But in terms of how the healthcare industry is seeking to optimize AI, as a certified professional coder, I love the thought of providing support to physicians, nurse practitioners, and other healthcare practitioners, as well as folks like me and our rev divers, to provide us with support in kind of automating that decision making and rules engine that goes into coding and medical record documentation. And we would love to kind of pick your brain about what's happening in that area of AI through medical coding.
Yeah, so this is been a very exciting time for us at Fathom, the industry writ large, in that what we're seeing is stuff that, when we got Fathom started, if you told me that we could do, half of, call it moderate complex cases, say emergency department, today, I'd be like very impressed. What we're seeing is the technology has moved so quickly that, we're reaching into the high 90s, and I think some of our clients will have 100% coding automation by end of year. And when I say coding automation, I mean that basically is for each encounter, the system has done everything you'd expect it to do, you'd expect a coder to do at a level of accuracy greater than, than a manual process. And so it's tremendously exciting. And what we're seeing is it is creating real bandwidth. So we have a lot of clients in the primary care space who historically they had their physicians do all the coding because the primary care volume is so great. And you just can't hire enough coders to do that. And you now have this intersection of physician burnout and this technology coming along where, for the first time, some of these very large primary care practices are basically having everything externally coded because AI has made it affordable. At the same time, they've really placed an emphasis on the physician or provider quality of life.
Wow. So, like every few years, I feel like coders get nervous about their overall like position in the industry, right? Like when we shifted to EHRs at first, everybody was like, "Oh, coders are going away. No one's ever going to need them anymore." But when I've spoken with a few organizations that have AI supporting their coding, and they haven't gotten rid of their coders. It's really like it helped them become less short staffed than they were before. Do you find that that's a trend? Like people are going to keep their coders, like they still have a role, and this is just creating like more reach within the organization? Or do you think that AI is just going to replace that role and these people should start looking for different positions?
I think that the interesting question is so pre-pandemic, the average age of medical coder in the United States was 54. So you could play that forward, imagine at 57. Um,
That sounds
the,
about right.
the demographic that had the highest rate of workforce abandonment over the past 3 years was 55 to 64-year-old women. And so you had basically, which, overlaps very heavily with the coding population. You had a population that was already really short staffed and a whole bunch of people come out of it. And at the same time, there doesn't seem to be as many new coders being produced. And so I think really for the folks that, are pursuing a coding career, there's so much opportunity because they are so short staffed, and it's more fun now because rather than having to go through and just do these rote routine examples, the machine handles all of that. And so you're now able to work to the top of your credential and only have to code out these encounters that are challenging, weird, idiosyncratic, like solve the tough problems that made coding initially exciting and interesting to you. So you'd be able to do lots of that, denials management, working with physicians on documentation improvement. I'm with like the same, our clients are doing the same thing that you've heard from other folks. It just seems like you've got these tremendously talented people who are now just going to be able to do more of what's interesting rather than having to do all this rather rote work to make sure that your claims are going out on time.
Well, and Kim, you're a coder. How does that make you feel? Like, what do you think when you said work at the top of your credential? I saw your face light up a little bit.
So coding individual encounters is not the best use of your resources, your manual resources. And I think this is what we kind of learned, through the public health emergency is how can we do more with less, but then how can we optimize and use our team to the best of their talent, to the highest level of their capability? And having someone like me sit down and code a manual encounter is not the best use of my time. So I 1,000% believe that AI is going to positively impact medical coding and that space. And you know, I what I also kind of see is doing coding audits and chart reviews. There's a lot of data that we pull manually from those reviews, and then we use that data to educate providers and their staff on best practices on documentation. Uh, However, there's also seems to be an opportunity for AI to provide some predictions in that process, right? And I'd love to get your perspective, Andrew, on how we can use our data to make business decisions.
You mean as coders or?
So as we're using kind of that machine learning and AI to kind of get ideas on bell curves and how how physicians are documenting and what their patterns of documentation look like. Are there any are there any opportunities for us to use that AI, that information that we're getting from AI, to make business decisions?
Yeah, I mean, I take that two ways. One, I think just the amount of routine labor that can be performed by the AI is going to free folks up to be able to do some of that more executive analysis that you wouldn't have time to do, just because you're flooded with, you know, getting things out the door. But two, yeah, answering questions around that and querying. This is stuff is very, very good at performing that analysis and doing it in a really human way. So, you know, querying like questions like, hey, like, you know, which physician tends to, you know, how many systems does Dr. X typically review in an encounter? Uh, why is it the case? Was it common? Like, and answer questions like that, that the machine is holding the context of what might be hundreds of thousands of encounters in its head, and can able to, you know, give you that like needle and haystack answer across those data sets. That I think is going to be enormously exciting. Also, you could, you know, actually even provide those resources directly to the physician. Like, I do think you'll get a point where the physician, instead of being like, hey, like this should have been a level 4 or level 5, like what's going on here, and then someone have to, like, you know, have it out with, you know, Dr. Brown. You can just, Dr. Brown can just chat with AI, and, you know, it'll explain in a detailed fashion why this was this way, point to, you know, the coding guidelines, exactly how it all works, um, rather than getting caught in a big loop.
I was just going to add to that. You know, part of the challenge that providers have is understanding the complexity of coding rules, right? So having that kind of clinical, I think in a EMR you have CDS, clinical decision making tools, right? And having that type of decision making tool from an AI perspective for a physician who is trying to document in between patients or documenting after hours when they're at home, dealing with kids and family, having that support that's automated, that can work with them on their time frame and at their skill level, I think would be a game changer for providers.
Yeah, I think we're just going to see a very exciting shift for providers that is going to make their experience much better. I think if you would have asked me 5 years ago uh, when we're going to get to a point of just system ambiently listening to dialogue in a care setting and creating all of the notes in a detailed and super functional and compliant fashion, I would have said decades away. But I think it'll happen in the next, you know, 5 to 10 years, where you will have fully autonomous scribes operating within the care settings. And so, you know, they don't even have to document anymore. They can just be fully present with the patient, which I think would be going to be super exciting.
I completely agree. And, while you guys were talking, I just started thinking about one of the biggest challenges that we see right now is recruiting staff and retaining staff. And whether you're a physician or a coder or a manager that's looking to assess, right, and look at trends, if I had an AI system when I was a practice administrator, I don't think I would have left that facility. This is just me personally. Like, can you imagine, like, Ken being a coder and, like, I'm going to look for a new job. Wait, nobody else uses this AI. I have to manually code everything again. Like, never mind. I'm going to stay where I am. I just wonder if this long term and this huge resource that it is for several departments in any clinic or facility, like if that's going to help drive retention of employees because it's such a significant resource.
Yeah, I think absolutely, and I think it also is going to um, make a lot of roles much more rich. Uh, these tools are super fun. It's exciting, and like you get to work with a new technology and push the boundaries of what can be done from a productivity perspective. Um, I think the next few years for the right people are going to be some of the most fulfilling years they've had at work because they basically get to adopt an entirely new wave of technology and figure out how it works into their workflows, which I think is, frankly, like I have a blast every day. There's a disproportionate amount of my work today that's just done by various AI tools that and I probably spend too much time playing with them, but it's fun.
Making your job fun, I think is so essential, particularly in healthcare, right? We're not dealing with a space that is free of tension and stress at all times, and we have all these tight timelines. I think the more fun your day can be, the better.
Yeah, absolutely. So, Andrew, we've talked a lot about the technology that's in the industry. We'd love to really kind of give our listeners an idea about what you and the team at Fathom are doing in this space and how you're innovating.
Yeah. So, at the top, I gave a little background on deep learning. Um, so that technology, Fathom really is the pioneer in terms of applying it to medical coding. And so, you could think a lot of the way Fathom works is we're a lot like a coding services company. The only difference is as opposed to, a bunch of people, in an office somewhere, it's all done in the cloud. And so our clients basically they ship us the encounters, the documentation to be coded. We turn around codes, and it's going to be somewhere between 85 to call it 98, 99% of the encounters are going to come back fully coded. And so the experience for our clients is that they basically overnight hired the most productive coder they've ever had that just kind of sits in the background and gets stuff done.
Awesome. Now, as we tend to do, we obviously value your expertise and your knowledge and your background. Is there any advice, knowing what you know from your lens, that you could share with our rev divers who are billers and coders and hospital executives and even software folks? Is there any advice that you would give them in terms of like adopting the model that we've been discussing today?
Yeah, so I'd say the big thing is play with the tools. I think proficiency in terms of managing these AIs, working with them, thinking about ways they can integrate and accelerate is going to be a huge differentiator for people in the employment market or as employers. And so, maybe, your office, your company, they're not like letting you play with some of this stuff in the professional setting. It doesn't stop you from, going home and hopping on Chat GPT and using it to, I don't know, write funny poems for your kids or, the applications are really kind of only bound by your own creativity. And so I just encourage people to play. Um, and soon enough, like you play with it in one setting, you'll begin to have ideas as to how, like, what the potential of it could be in your professional environment.
Wow, that's wonderful advice. Thank you so much for being with us today, Andrew. It's been an absolute pleasure talking to you.
It's been so great, and I appreciate the questions. They're fantastic.
Yeah.
Oh, we love it. We're going to have you on another episode when we do some more talking about Skynet.
There's people with a lot more tinfoil in their headwear that I think you'd be better suited for those conversations than me. But
Fair enough. Well, again,
Yeah.
thanks so much, Andrew. And Rev Divers, until we meet again, keep diving into those rev cycles.